Hello everyone, I'm Dr. Minto. I'm currently doing my senior residency in AIMS Delhi. So I have started this channel and I'll be uploading videos. I hope these videos help you in acing your university exams, NEET PG as well as any set exams. So let's move on to the topic. So I'll be taking histology in two videos. One is general histology and other is systemic histology. So in general histology, the first thing you have to know is epithelium. So the epithelium can be single layered epithelium or multi-layered epithelium. Single-layered epithelium is also called as simple epithelium, whereas multi-layered epithelium is called as stratified epithelium. And based on the shape of the cells in the individual epithelial layer, it is classified as squamous epithelium, where it consists of flattened-shaped cells, cuboidal epithelium consisting of square-shaped cells, and columnar epithelium consisting of vertical rectangle-shaped cells. So in squamous epithelium, you'll be seeing flattened shaped cells where the height of the cell is less than the width of the cell with elongated flattened shaped nuclei. So this is how you draw a simple squamous epithelium in your exam. When you look at the microscope, you'll be seeing these flattened shaped cells with flattened nuclei in them. So you can see them in the alveoli of the lung and in the cavities of the body, which is pericardial cavity, pleural cavity, and peritoneal cavity. So in all these cavities, this squamous epithelium is called as mesothelium. You can also see the squamous epithelium in the inner layer of the heart, where you call it endocardium. And you can also see the squamous epithelium in the innermost layer of the blood vessel and the lymphatics. So coming to the cuboidal epithelium, in cuboidal epithelium you will be seeing square-shaped epithelium where the height of the cell is equal to the width of the cell with center round-shaped nucleus, and this is how you draw a cuboidal epithelium in your exam. So coming to the microscopic image, here you can see individual square-shaped cells with center round nuclei. So you can see this cuboidal epithelium in thyroid gland on the surface of the ovary, kidney tubule. So this is a kidney tubule. I have given you the image of the proximal convoluted tubule of the kidney. You can also see the cuboidal epithelium in the choroid plexus, inner surface of the lens, and pigmental cell layer of the retina. But I suggest you to remember these three things, which is very important: thyroid gland, surface of the ovary, and the kidney tubule. So coming to the next epithelium, which is columnar epithelium, where you will be seeing vertical rectangle shaped cell where the height of the cell is greater than the width of the cell with elongated vertical nuclei. So based on the presence or absence of the additional structures, it is classified into three types. One is simple columnar epithelium, other is ciliated columnar epithelium, and then brush border epithelium. As the name suggests, simple epithelium doesn't have any associated structures. Ciliated columnar epithelium has associated cilia, whereas brush border epithelium consists of microvilli, and it is called as brush border epithelium because the light microscope cannot be helpful in uh, that much resolution of the microvilli. You need a better resolution microscope to actually see the microvilli. So in a light microscope, you will be seeing the microvilli as a brush border. So that's why it is called as brush border epithelium. So the simple columnar epithelium is seen in stomach and large intestine, whereas ciliated columnar epithelium is seen in the respiratory tract, uterus, fallopian tube, efferent ductules of the testis, central canal of the spinal cord, and the ventricle of the brain. Whereas brush border epithelium is seen in GB and small intestine. So when you actually look in the microscope, you can see vertical elongated shaped cells where the height of the cell is greater than the of the width of the cell with the elongated shaped nuclei. So coming to the next thing, which is multi-layered epithelium. In multi-layered epithelium, you'll be seeing multiple layers of cells. So how you classify this epithelium is based on the shape of the cells that is present in the topmost layer of the epithelium. So based on the, if it is a squamous epithelium, it is called as stratified squamous epithelium. If the topmost layer of the cell is uh, cuboid shaped, it is called as stratified cuboid epithelium. Whereas if the topmost layer of the epithelium is columnar shaped, it is called as stratified columnar epithelium. So the most important among this multilayered epithelium is stratified squamous epithelium and transitional epithelium. So in this transitional epithelium, you will be seeing umbrella shaped cells. The stratified squamous epithelium, based on the presence or absence of keratin, it is classified as keratinized stratified squamous epithelium and non-keratinized stratified squamous epithelium. So coming to the stratified squamous epithelium, based on the presence or absence of keratin, I've told you it is classified into keratinized stratified squamous epithelium and non-keratinized stratified squamous epithelium. So here you will be seeing a layer of keratin, that is the only difference. And also the topmost layer of the cell is basically flattern shaped cells. So whenever you get a multi-layered epithelium in your histology, first look for the topmost layer. So topmost layer, what is the shape? If it is flattern shape or it is umbrella shaped. So if it is flattern shape, it is stratified squamous epithelium. If it is umbrella shaped, it is transitional epithelium. And if it is flattern shape, look whether it has keratin or not. When it has keratin, it is a keratinized stratified squamous epithelium. So here you can see a thick layer of keratin in the microscope. So this is basically a stratified squamous epithelium, which is keratinized. So keratinized stratified squamous epithelium is seen in the skin. So this is image is that of skin. Whereas non-keratinized stratified squamous epithelium is seen in mouth, tongue, pharynx, esophagus, vagina, and cornea. So coming to transitional epithelium, as I have previously told, you will be seeing umbrella-shaped cells at the topmost layer of the epithelium. So in the microscope, you will be seeing basically umbrella-shaped cells. So this umbrella-shaped cells helps you in identifying the transitional epithelium. And transitional epithelium is very important because you see it in the urinary tract from the level of renal pelvis till the level of urethra. So you'll be basically seeing it in the renal pelvis, ureter, urinary bladder, and parts of urethra. So I strongly recommend you to have a good look at this image because it is very important for your exam. So coming to glands. So basically glands are classified into exocrine and endocrine glands, which you all basically know. Exocrine glands basically have ducts, whereas endocrine glands doesn't have ducts. So I'll give you an overall classification for the gland, but this you will not get any slides particularly based on glands, but this will help you in identifying the particular systemic organ. So glands are basically classified as simple glands and compound glands. So in simple glands, you will be seeing only single major duct, whereas in compound glands, you will be seeing multiple ducts which will be opening into a major duct. So and basically based on the shape of the glands, you will further classify it into alveolar shaped gland, tubular shaped gland, or coil tubular shaped gland. So this is the basic outline of the types of gland. So they can be simple alveolar, simple branched alveolar, simple tubular, simple branched tubular, and simple coil tubular. In compound glands, you can see compound alveolar, compound tubular, and compound tubular alveolar. So next major important thing in your histology is cartilage. I'm damn sure that you will get at least, sorry, I'm damn sure that you will get at least one of the slides in this cartilage section. So cartilage is basically divided into three types, which is hyaline cartilage, fibrocartilage, and elastic cartilage. So in hyaline cartilage, you'll be seeing a homogeneous background with nest of cells. So this homogeneous hematoxylin stained background with nest of cells with few of them having nuclei in them is hyaline cartilage, which is basically seen in the costal cartilage, articular cartilage, larynx, trachea, bronchi, and nasal septum. In fibrocartilage, you'll be seeing multiple layers of fibers. So basically, the background is not homogeneous and the number of cells is relatively less when compared to that of the hyaline cartilage. So basically, you'll be seeing lots and lots of fibers and a non-homogeneous background. So that will help you identify the fibrocartilage. And this fibrocartilage is basically seen in symphysis, articular disc, glenoid labrum, and acetabular labrum. So the third most important thing is elastic cartilage. In elastic cartilage, you'll be seeing very large cell when compared to that of the hyaline cartilage and the fibrocartilage. And the key important features is that it has elastin fiber. And I'll tell you this elastin fiber is not uh, particularly stained in hematoxylin and niacin. They will use a particular stain for the elastin fibers which has affinity for silver. So they'll be using a silver stain and it will take a black color. So whenever you see a large cell with black fibers, you can damn sure write it as elastic cartilage. And this elastic cartilage is seen in pinna, epiglottis, and corniculate and cuneiform cartilage of your larynx. So in cartilage, you have to identify basically whether it is a homogeneous background or heterogeneous background. When it is a homogeneous background with nest of cells, you write it as hyaline cartilage. When you find a heterogeneous background, you basically look for smaller cells and larger cells as well as the number of cells. When you find it less number of cells and smaller number of cells and with multiple amounts of fiber, so it is fibrocartilage. And the key important feature in elastic cartilage is that it takes up silver stain, and it also has larger size of cells. So let's do a practice session for this cartilage. So first thing is to identify the background. So in this first slide, I'm seeing a homogeneous background. And in this second image, I'm seeing a heterogeneous background. And similarly for the third image also. Now I am looking for the cells. So here I'm seeing nest of cells. So basically it is a homogeneous background with nest of cells. So this is a hyaline cartilage. Here I am very rarely seeing cells. I couldn't focus maybe one or two here and there. But I can see enormous amount of fiber and it is not having any specific stain for it. So this is basically a fibrous cartilage. And similarly, the size of the cell is also very small. But here I can see enlarged cells or very large cells. So this has large cell plus heterogeneous background and it also has specific black stain. So this is elastic cartilage. So coming to the next important topic, which is bones. So bones, as you already know, it is divided into compact bone and cancellous bone. Compact bone is nothing but the bone has no space. It is tightly packed. So it is, as the name suggests, it is compact bone. Whereas in cancellous bone, here you can see it has enormous number of spaces and these spaces are basically filled with bone marrow. So when you take a cross section of the compact bone, you will see something like this, and this each individual unit of the bone is called as osteon. So in this osteon, what you will see is that central Haversian canal. This central Haversian canal carries the blood vessels for the that is required for the bone, which is surrounded by multiple layers of lamella. And between these multiple layers of lamella, you'll be seeing the osteocytes. So these dark things are nothing but the osteocytes. And finally, you'll be seeing the outermost layer or the periosteum of the bone. So this is a cross section of the compact bone. So when you get a longitudinal section of the compact bone, so this is basically the Haversian canal, which I have shown you here. And there will be channels that are connecting the Haversian canal to the periosteum of the bone. And these channels are called as Bookman channels. So Haversian channels are basically seen particularly in the cross section of the bone at the center, and they are seen as a longitudinal channels in the longitudinal section of the bone. But these Bookman channels will be seen only in the longitudinal section of the bone. This you must remember. Coming to the cancellous bone, as I have previously told, this cancellous bone you'll be having multiple lacunae, and these lacunae are filled with bone marrows. So this is how you will see the cross section of the cancellous bone. So this is the lacunae, and this lacunae is filled with multiple bone marrow, and these are surrounded by the lamella. But here you can see the lamella are not properly arranged as that of the compact bone. See, in compact bone you are seeing properly arranged, compactly packed lamella, whereas here the lamella are kind of disorganized. And you can also see the osteophytes. These pink things are the osteophytes. So in microscope you will get an image something like this. So this is the lacunae. I'm sorry, so this is the multiple lacunae that you are seeing in the cancellous bone, and these lacunae are filled with bone marrow. And here you can see the fat bone marrow, and this is the lamella that is surrounding the lacunae. And this lamella also contains multiple osteophytes. So this is how you will see the cancellous bone. So bones basically you will get three sections. One is the cross section of the compact bone, the other is longitudinal section of the compact bone, and other is a cross section of the cancellous bone. So you can easily identify when you see multiple round or oval shaped lamella which is tightly packed to the periosteal layer. You can easily identify it as a cross section of the compact bone. In the longitudinal section of the compact bone, you'll be seeing Oakman channels as well as the Haversian channel, with which you can easily identify the longitudinal section of the compact bone. And cancellous bone cross section is very easy. You just have to see the lacunae that is filled with bone marrow. So this will be helpful for you in identifying the cancellous bone cross section. Moving on to the next topic, which is the muscle. So muscle, you will have individual muscle fibers. So these are the individual muscle fibers, and these individual muscle fibers are covered by a layer of endomysium. So the individual muscle cells are covered by a layer of endomysium, and this multiple muscle fibers join together to form a muscle bundle, and this muscle bundle is covered by the perimysium, and these multiple muscle bundles join together to form an entire muscle, and this entire muscle is covered by the epimysium. So basically you have an individual muscle fiber which is covered by endomysium, and this individual muscle fibers group together to form a muscle bundle which is covered by perimysium, and multiple muscle bundles join together and it is covered by a epimysium, and finally it forms a muscle. So muscles are basically divided into three types, which you already know, which is skeletal muscle, cardiac muscle, and smooth muscle. So first thing you have to identify is that whether it is striated or striped or not. So here you can see this individual muscle fibers are striated. So when it is striated, it can be two things. One is skeletal muscle or it can be cardiac muscle. So how can you identify this both? In skeletal muscle, you will be seeing an individual muscle fiber. There is no branching at all, and you can see the nuclei at the periphery of the individual muscle fibers. So this is how a longitudinal section of skeletal muscle will look like. When you take a cross section, you can see the individual muscle fibers covered by the endomysium and the muscle bundles covered by the perimysium. And very rarely you can also see the epimysium, but generally you will not get to see because you'll be seeing a very small section of the individual muscle bundles. So moving on to the cardiac muscle. In cardiac muscle also you'll be seeing striations, but one thing you can see is the branches in the cardiac muscle. See, this is an individual muscle fiber which is branching, and one more thing that will help you is the centrally placed nuclei. So here you see a striated muscle fiber that is not branching, and you'll see peripheral nuclei. Whereas here you'll see central nuclei and branching. So this too will help in differentiating between the cardiac muscle and the skeletal muscle. So this is the microscopic image of a cardiac muscle. So you see individual muscle fiber, you see whether it is striated or not, and here you can see branching. If branching is not clearly visible, you look for a central nuclei. So smooth muscle is very easy because when you don't see any striations, you can easily identify them as smooth muscle. So here you can see spindle shaped smooth muscle fibers and you don't see any striations in them. So this is how the microscopic appearance looks. No striations, very easy, smooth muscle. Coming to the neural tissue is similar to that of muscular fibers at cross section. So here you'll be seeing individual nerve tracts that is covered by the myelin, which is in turn covered by the endoneuron, and multiple nerve fibers join together to form nerve bundles, and this nerve bundle is covered by perineuron, and finally the whole nerve is covered by epineuron. So this individual cross sections, you will be seeing something similar to that of the muscle, but how you differentiate from the muscle is the presence of myelin, and this myelin is stained using special stains. So here you can see this black stain which denotes myelin, which is basically not seen in a muscle fiber. So this is how you identify cross-sectional difference between the nerve fibers and the muscle fibers. And this is pure hematoxylin and eosin stain of the nerve fiber. In this hematoxylin and eosin stain, you can see multiple layers of myelins. And this myelins generally very poor uptake of hematoxylin and eosin stainosine. So here you can see a relatively colorless field of myelin. And coming to the individual cell body of the neuron, you can see a very large nucleus that will almost occupy more than 50% of the cell body with surrounding nuclear granules and dendrites. So this is how you will see it in a microscope. So there will be a large nucleus and multiple dendrites and multiple nuclear bodies. This nuclear body is trained very good on hematoxylin and eosin stain, which will be taking up predominantly hematoxylin stain. So coming to vessels, vessel is very important because uh, at least one slide in your histology will be on vessels mostly. So vessels basically there are two types. One is artery and other is vein. So whether it is artery or vein, the individual layers of the vessel is the same. So it is basically divided into three layers. One is intima, next is media, and next is adventitia. So this intimal layer is further divided into three. So one is the epithelial layer, next is lamina propria, and next is the internal elastic lamina. So this intimal layer is divided into three: epithelial layer, lamina propria, and internal elastic lamina. Media layer is nothing but the muscle fibers, and there is an external elastic lamina, and then followed by the adventitial layer. In adventitial layer, in very large vessels, you can also see tiny blood vessels, and these tiny blood vessels are called as vasovasorum, and these blood vessels will be the one that is providing nutrition to the large vessels. And large vessels, especially when a section of aorta is given, this vasovasorum will be helpful in differentiating aorta from other small vessels. So coming to the differentiation between artery and vein. So the first image is that of an artery and the second image is that of a vein. So in artery and vein, the same three layers, intima, media, and adventitia will be present, but the proportion is different. So here you can see the intimal layer. This is the media layer and this is the adventitial layer of the artery. So here you can see the media is more thick when compared to that of the adventitia, whereas in vein the adventitia is more thick and when compared to that of the media. See in this image the media is almost not visualized. So when you look under the microscope you will see images like these two. So we will identify which is artery and which is vein. So I will be giving you important tricks to identify which is artery and which is vein. So first thing is shape. When you see a oval or round shaped thing, it is an artery. When you see something that is collapsed or irregular shape, that is vein. So here you see an oval shaped thing. So this is an artery. Whereas here you see a collapsed or irregular shaped thing. So this is vein. So first differentiation is over. Okay, then second, how can you differentiate this presence of the muscular layer? So here you can see a very big muscular layer, whereas here you see a prominent adventitial layer when compared to that of the muscular layer. So if you see a very good muscular layer, it is artery. If you see a very good adventitial layer, it is vein. So the basic two things is to first identify the shape. If it is very well oval or round shape, it is artery. And if you see a predominant muscular layer, it is artery. When the shape is so irregular, it is vein. And when you predominantly see the adventitial layer or you don't see the wall at all, then it is vein. So coming to lymphatics and lymphatic system, you'll be given three important slides, which is very important. Please read this before going to your histology exams. So in lymphatics, you will be given three slides. One is lymph node, other is spleen, and other is thymus. So basically, when coming to the cross section of the lymph node, you'll be seeing a capsule, multiple trabeculae, and there is a outer cortex layer. This is a cortex layer and the inner medullary layer. So in the cortex layer, you'll be seeing multiple lymphatic follicles. So this lymphatic follicle, how can you identify is that there will be having an outer dark layer and an inner light layer. So coming to the microscopic image, so this is how a lymph node will appear. So first you have to identify the outer capsule. So this is the outer capsule. So this will be the cortex and this layer will be the medulla. So in the cortex, you'll be seeing lymphatic follicles. As I have said, they will be having an outer dark layer and an inner lighter core. And in medulla, you'll be seeing multiple blood vessels, though not properly seen. However, still you can differentiate between the cortex and the medulla. Next, coming to spleen. Same spleen has a capsule with multiple trabecula, but here it is not divided into cortex and medulla. Here it is divided into a red pulp and white pulp. In red pulp, you'll be having multiple blood vessels, whereas in white pulp, you'll be having the germinal centers or the lymphatic follicles. Similar to that of the lymph node, you'll be seeing an outer dark layer and an inner light layer of the germinal follicle. However, how can you differentiate between spleen and the lymph node is that you can see the capsule. Beneath the capsule, you'll be seeing a red pulp where you'll be seeing lots of vessels, whereas in lymph node, just beneath the capsule, you will be seeing the lymphatic follicle. So basically, you try to identify the capsule, whether you can see the capsule in the specimen, and immediately beneath the capsule, if you see a germinal center, it is immediately just beneath. If you see a lymphatic follicle or germinal center, then it is basically a lymph node. If you see multiple vessels, then it is basically spleen. So here you can see this is a capsule, and here you can see enormous red pulp, and here comes the white pulp or the germinal center. So basically look for the capsule. If you immediately find a lymphatic capsule, lymphatic follicle beneath the capsule, then it is lymph node, and you can divide it into cortex and medulla. Whereas in case of spleen, immediately beneath the capsule, you'll be seeing red pulp filled with multiple blood vessels, and one in white pulp you'll be seeing the germinal centers. And one more thing in spleen is that whenever you draw a spleen, always draw a vessel with multiple perivascular lymphocytes. So this is more characteristic of the spleen. Though you do not see it that clearly in a light microscope, when you draw it in exam, this is very important and it will help you fetch more marks when compared to your colleagues. So coming to thymus is very easy. You can see multiple lobes. So multiple lobes you can see, and these multiple lobes are further divided into cortex and medulla, outer dark cortex and inner light medulla. And between these multiple lobes, there is a septa or connective tissue, and in this septa or connective tissue, you'll be seeing cell corpuscles. And this is very important for your NEET PG and any set exams. So basically in lymphatic system, you'll be seeing three things. One is lymph node, spleen and thymus. When it is divided into multiple lobes with an outer dark cortex and inner light medulla with Hessel's corpuscle, then you can easily identify it as thymus. Differentiating between lymph node and spleen, basically you have to see the capsule. Immediately beneath the capsule, if you see lymphatic follicle and it is different and it is can be differentiated into an cortex and medulla, then you are basically seeing a lymph node. When you see red pulp, that is vascular tissue immediately beneath the capsule, and the lymphatics are basically concentrated on the inner surface of the slide, then basically you are seeing a spleen. So lymph node is basically divided into cortex and medulla, whereas spleen is basically divided into white pulp and red pulp. And one more thing I've told you is that whenever you draw spleen, you have to draw perivascular lymphocytes, which will fetch you extra marks. So coming to the last slide for this video, it is skin. As I have previously told you, skin has stratified squamous epithelium, which is keratinase. So basically, you'll be seeing a layer of keratin which will help you identify the skin. And coming to skin, skin has basically 5 layers. So the keratinized part is called as stratum corneum, and immediately beneath the stratum corneum, you'll be seeing a lucent layer which is called as stratum lucidum, and immediately beneath that, a thick hematoxylin stain cells with multiple granules. That is why it is hematoxylin stain, that it takes up hematoxylin more. It is called as stratum granulosum, and immediately beneath that, you will be seeing a predominant stratum spinosum. And why it has got its name spinosum? This is because of the shape of the cells, which is basically spine shaped or multiple finger shaped. And the last layer is a stratum basale, which forms the basalmost layer. So you'll be seeing stratum corneum, stratum lucidum, stratum granulosum, stratum spinosum, and stratum basale. So this is how the microscopic appearance of skin will look like. So you will see keratin, and by seeing the keratin itself, you will identify it as skin. I know you will be all thorough in it by now. So coming to the layers here, you will be seeing stratum corneum, then stratum lucidum. Here it is not that very well appreciated, but still you can see through it carefully. Then there is a darkly stained layer which is a stratum granulosum, and followed by stratum spinosum, and the last layer that with multiple indentation, this is a stratum basale, followed by which you will be seeing dermis and hypodermis. So thank you for patiently listening to this.